I'm Selina Brown. This is my informative speech, and it's March 12th. 1 out of every 800 people born in the United States is diagnosed with Down syndrome. This comes out to be roughly 6 million Americans. The chance of someone being born with this disorder increases as a mother's age increases. This can be seen by the graph created. It displays the percent of those affected by Down syndrome out of 1,000 pregnancies in relation to the mother's age. According to a study done by the American Pregnancy Association, a woman at the age of 35 is twice as likely to carry a baby that is affected by Down syndrome than a woman at the age of 30. Imagine you being that 1 out of 800 and how drastically your life would be affected. Would you be where you were today if you had that extra chromosome? I have personally seen how a person's life is affected due to Down syndrome. My aunt has this disorder and her lifestyle is significantly different than any ordinary person. She is still dependent on those around her to help her with everyday simple tasks. Having this disorder has stopped her from doing many of the things that we learn to do at an early age, such as dressing ourselves, feeding ourselves, or even driving a car. This disability was discovered and named after a British physician, John Down. Down syndrome is caused by an extra copy of chromosome 21 and is the most common form of mental retardation. Today, I'd like to help you better understand how Down syndrome is diagnosed, the characteristics of Down syndrome, as well as experimental treatment options. Having a better understanding of Down syndrome will show you just how big of an impact one extra chromosome can have on someone's life. The first thing I want to talk about today is the diagnosis of Down syndrome. Down syndrome can be detected early on when the baby is still in the womb. There are 2 forms of tests to determine whether or not the fetus will have this disorder. The first type of test available is a screening test. These tests will estimate the risk that a fetus may have Down syndrome. They are very easy to perform and very affordable, but unfortunately, they're not very accurate. They're unable to give a definite answer whether or not the baby will have Down syndrome. Screening tests include the nuptial translucency test, a multiple marker test, a genetic ultrasound, and an integrated screen test. The purpose of these tests are to mainly help the parents decide whether or not further diagnostic testing is needed. Unlike screening tests, diagnostic tests are 99% accurate in detecting Down syndrome, as well as many other chromosomal abnormalities. With these tests, there is a high risk of miscarriage, as well as other complications due to the fact that tests take place inside the uterus. Diagnostic tests are usually only recommended for women over the age of 35, those with a history of genetic defects, and those with abnormal results in a screening test, due to the high risks involved. Next, I would like to tell you about the characteristics of Down syndrome. This disorder causes a few different abnormalities, which are both physical and mental. During the first few months of life, the acquisition of skills and capabilities is normal, but eventually begins to decrease as time goes on. According to Marie Percy, who wrote an article published in the Journal of Developmental Disabilities, the development and intellectual of physical skills are sometimes delayed by a year or more. Some of these skills include everyday tasks such as walking up and down the stairs, getting dressed, and the ability to construct sentences. Out of all of these skills affected, speech seems to be the most affected area of development. Abnormalities of physical characteristics are also present in patients with Down syndrome. Some of these include a short, broad skull, short hands with small fingers, a small mouth, flattened nose, and other dysmorphic body features. Some babies with this disorder are born with short necks, and instead of having 3 creases in the palm, there's one that goes straight across and one that curves down by the thumb. A person with this disorder is usually short and has looseness of the joints. Not all patients with Down syndrome have all of these characteristics, but in the majority of cases, these are the ones that are the most common. The last thing I would like to talk about is the experimental treatment options. There is no cure for this disorder as of today, but something new has been discovered. A compound known as the sonic hedgehog pathway agonist has been identified. This compound is known to reverse the learning disabilities affected by Down syndrome. It has been proven that this compound will reverse the learning disabilities in mice, but has not been able to help humans just yet. Professor Roger Reeves, the faculty director at the Johns Hopkins University Transgenetic Core Facility, led a group of researchers and has come to the conclusion that this compound will dramatically boost the learning ability and memory. A single dose allows the cerebellum of the rodent's brains to grow to a normal size. This relates to humans with Down syndrome because they usually have a cerebellum that's 60% smaller than the usual size. After the mice received the compound, they were able to function just like the other mice without any learning disabilities, as if they were never affected by Down syndrome. Professor Reeves, as well as researchers working with him, have said that their experiments with this compound will soon lead to developing drugs similar so that it may have the same effect on humans. Although there is no solution to reverse the effects of the disorder today, the research that Professor Reeves and his team are doing will continue until one is found. Down syndrome affects every part of a person's life in many ways. They have to rely on others for everyday tasks and won't have a lifestyle that most of us are used to. There are several tests to diagnose whether a baby will be born with this disorder or not, but unfortunately there is still no solution. Although the compounds being tested will eventually be able to reverse the effects of Down syndrome on learning disabilities, it is not known whether the physical characteristics will also be reversed. Hopefully soon there will be a discovery of a new medicine that will be able to prevent the effects that Down syndrome will have, so that the ones affected by this disorder get a chance to live their lives without any obstacles in their way.